Welcome to Fit Faith and Purpose 360 Total Woman Podcast. I'm your girl Deirdre. If you have not already liked and subscribe on all social with the podcast platforms and YouTube, please go over and support your girl. We are a community of women over 40 who are willing to get the information we need to take on our life, our purpose, take back control, take authority, and also be present in our own healing and also present in on the woman we want to see. So come on and support you, girl. I'm excited about this new podcast. Today, this is part 2 of owning your own recovery through physical therapy. So I brought back Jordana and I'm so excited. But before we bring her to the stage, if you do a little housekeeping, if you have not already went over to Barnes & Noble and Amazon, I now have Living a Fit, Faith, and Purposeful Life book for women over 40 that is live and up. It's the relaunch of this book. There's a bonus chapter. So in that, I walk you through a few of the lessons that I've learned through my life over the years. So it's definitely an amazing short read. And I truly hope that it blesses you. Also, there's a workbook over on the Amazon side, soon coming to Barnes & Noble as well. So without further ado, I am bringing to the stage my physical therapist, the most amazing Jordana.
Hello. I like that introduction, Dee Dee.
Thank you.
I love it.
Listen, I am so excited to have you back again. The last podcast was so great. We had such a great turnout, and it helped a lot of women to understand what physical therapy is, what their role is, of course, what your role is as well, and then give them an idea of what physical therapy is. So that podcast, if you have not listened to it, you need to go back and listen to it. Jordana gives great information on physical therapy and owning your own healing process and what your role is. So today in part 2, we're going to move down on the body a little bit. We're going to talk about hip replacement and knee replacement, what those are, what physical therapy is. And we're just going to have some chat because I was really shocked, Jordana, at the information of doing research at how the numbers are very high in women other than in men having hip replacements and knee replacements. So let's jump into the conversation, what your view is on it. But before I guess we do that, because this is a part 2, we need everyone to meet you again. Tell them about yourself for those who don't know. Go ahead.
Yeah. So I'm Jordana. I am a physical therapist at Physical Therapy Institute in Sherwood. I've been doing it since 2018, graduated from UCA. I love my job. I work in outpatient, so I see a variety of things, a lot of geriatric patients, a lot of athletes, anywhere from your head to your ankle. I see it all, and I enjoy that. I enjoy the variety of it. But yeah, I'm excited to be here. Excited to talk to you again, Dee Dee.
Awesome. I'm so glad that you're here. So we're going to jump right in. So from what I saw, the statistics are really close to about 60% of the women that are getting knee replacements and getting hip replacements. So do you know why that is happening?
Yeah.
And is there something we can do to prevent that if possible?
Yep. Number one thing I think as to why it's more prevalent in women versus men is our anatomy. Women, we are born with wider hips, and that's going to put maybe not a worse, but a different load on our hip joints and our knee joints and our ankle joints and everything above and below. Just a different kind of load. And I think that's why it's more prevalent in women. Is just because of our anatomy. And we can't help our anatomy. We're born with wider hips, obviously, because we have the opportunity to give birth. But it is different. I mean, you can look at pictures and look at the anatomical differences between men and women, especially in your pelvic area. And your hip is literally connected to your pelvis. So that's the main reason. And then if you think about if your hips are wider and from the angle from your hip to your knee, we call that your Q angle. Women's Q angle is typically wider, and that's just going to put a different load on your knee joint as well.
Right.
As far as what we can do to prevent it, being active, and also being like proactive about it. So, you know, activity is good for our joints. Different kinds of activity too. I think a lot of women think, well, I just need to walk every single day, you know, to get strong. That's great. Walking's great. Don't get me wrong. Do that every single day, but also incorporate maybe some weight training or some yoga or something else to help strengthen those joints and muscles. And that will hopefully prevent it, but if not prolong your need for it for a joint replacement.
Wow. How much do weight play? Because we talked about the anatomy and now, we can't help that we give birth and that's what it
Yeah.
is. What can we do to also minimize that in our weight load? Because also in the last podcast, that's something my doctor talked about in recovery with back is it's almost like to a table. You can only put so much weight load on the table and then eventually it gives way. So
Yeah.
that's according to the spine. But now we're looking at the hip and the knee. What is our weight play a role in that?
Yeah. And I would say even more so for your hip and your knee, because yes, your spine takes load, but every time you stand, every time you walk, every time you sit, that hip joint is going to take, you know, whatever weighted load that you have that puts on it. You know, and I never say, people come to me all the time, you know, talking about, oh, if I just had lost weight, I wouldn't be in this position. And that's not true. Like most of the time, you're at some point in your life, if you have these problems, you're going to have them anyways. But weight management is a great way to prolong that and possibly prevent it at having to get one of those joint replacement surgeries. But I think that, like I talked about a second ago, just being active and walking, swimming, finding something that you like to do that's going to help maximize those joints and mobility and your strength.
Right. So, what is the difference between, let's say I do have to have surgery, I got to have a hip replacement or a knee
Yeah.
replacement.
Yeah.
How important is it to get into therapy, and at what point is important versus waiting till later, say 6 or 7 months down the road?
Yeah. So specifically for hips, and you and I talked a little bit about this, Dee Dee, not all surgeons require you to have PT after a hip surgery. And there are several reasons. Your hip joint heals a little bit easier than your knee does or other joints in your body. There's also some research that shows that supervised exercise versus unsupervised exercise, there's not a whole lot of difference in the outcomes long term. But again, that's if you're actually doing what you're supposed to be doing. There's zero complications, and you don't have a ton of crazy goals that you want to get back to. But getting to PT initially, especially after a hip replacement surgery, I think is important. And I talk to my patients about this all the time. Even if like early on you're skeptical, if you need PT, like say your surgeon didn't require it, come once a week for a few weeks and see how you do. If anything, it's going to help with your pain management. You also have hip precautions after a hip surgery, which basically means you have to avoid certain motions. That's confusing for a lot of people because you can't bend further than 90 degrees. Well, how do you get your shoe on and off? How do you take a shower? Like those things are confusing to people. And I think if anything, just getting in, even like I said, even if it's just once a week for a few weeks, just to get more education on what you can and can't do for a little bit is
Right.
important. And not only that, but you're also walking with a walker. There's chances for complications such as infection and different things like that you might not know what the signs are for it, and us as PTs know what to look for. So, I'm always going to advocate for PT early on after a joint replacement surgery. But I think it's more like people need to hear it more for hips because it's not a requirement. After a knee surgery, they're going to make you go to PT. It's very important after a total knee replacement.
Okay.
If your surgeon doesn't tell you to go to PT right after a total knee replacement, then you need to find another surgeon because
Right.
99.999% of the time you're supposed to go to PT.
Right.
So I think, most of the time you're going to go after a total knee, but I think people either they're not told to go to PT or don't understand why they need to go to PT after a hip replacement. But it's the same concept. You're going to get stronger quicker. You're going to get your range of motion back quicker. Your pain's going to be decreased quicker. Your gait's going to be better quicker.
Yeah.
And a lot of times, I mean, I have talked about these complications, but another complications that you have with a total hip is
Mhm.
that your leg length can actually be different. And, surgeons try their best to make your legs equal after a hip replacement surgery, but sometimes that doesn't happen.
Oh, okay.
And if that doesn't happen, sometimes you need like a heel lift in your shoe that will make your legs equal, um, or else your gait's going to be altered, and that's going to lead to back pain later on, or pain in your other hip later on. And those are some things that I know to look for that you might not know to look for initially.
So this is great information. Is there a way to say, if I'm going to have a hip replacement, is it important that I come see you before to kind of get this information? How
Yeah.
important would that be?
So I always advocate for something that we refer to as prehabilitation, which is basically just a little bit of PT before a surgery. Number one, it helps you get more educated on the surgery that you're going to have, what to expect afterwards. Because I think a lot of people go into a surgery almost kind of blindsided, and they don't realize how painful it's going to be, or how difficult the recovery is going to be, or how long they're going to have these hip precautions, which are a long 6 to 12 weeks typically. Um, and so they don't really grasp all that information. They just know that they have to get surgery because their hip hurts. Um, so I think that is a big thing, is just education in general before surgery. But also, if you strengthen all the muscles around your hip, if you get your range of motion as good as you can before surgery, that's going to help your outcomes tenfold after surgery. It's going to be that much easier and that much quicker of a recovery if you're in a good spot before surgery. And most of the time, people are not in a good spot before surgery because they're hurting and they're not doing anything because they know they're going to have surgery. So,
Right. Yeah. Especially women, we tend to care about everyone else. We
right.
tend to care about making sure the home is right, the kids are right, family is right prior to surgery. But we never think of, like you said, the little things we take for granted. Like, if I can't bend to a certain degree, then I'm needing to know how to put my shoes on. I need to know how to do all of these things.
Yep.
So I think you touched on a great point of making sure that we come in having the pre physical therapy so that we know what to do, how to take care of ourselves, and then get the questions answered so that we are equipped with the information to even go to our doctors to say,
Yep.
listen, what do you think if I choose to do the surgery? I think having physical therapy is important to me, and I want to make sure that I even just get the correct body mechanics,
Yep.
because it's easy to feel good, after surgery, get this rush of energy that you feel good, but that tends to be the place where patients get into trouble the most,
Yep.
because now you think your body can do whatever, and then you forget, and you just feel good today. That
Yep.
doesn't mean that you can go do everything you've done before.
Yep.
Definitely in our field, I've noticed that people have gotten in trouble and had to go back into surgery because
Yep.
they hurt themselves, they either caused a new fracture, or something has pushed them back in. So I think that is so important. So let's go down to the knee. We talked about the hip replacement,
Yep.
and you said that the knee, that they really want you to get back in. How important is for a woman to own her recovery with knee replacement, without, because there is a process of healing through physical therapy, and it can be rough the first couple of sessions that you
Mm-hmm.
come in. That's just the honest truth. But how important is it to push past that so that you
Yeah.
can get to where you need to be?
Yeah. So I would say the first week or two is mainly about, we call it making the knee quiet, quieting the knee. So basically decreasing your pain, decreasing your swelling, getting it moving as pain-free as possible. The first 2 weeks is mainly that. So, those first 2 weeks, I'm not going to ask you to kill yourself trying to get your range of motion to normal. That's not going to happen in the first 2 weeks anyways.
Right.
All I'm going to ask you those first couple weeks is to get up and move as much as you can and do the exercises that I give you to your best ability. Um, and ice, compression, all of that stuff to help with the swelling. So I think the first couple weeks people come in and they're scared, because, they just had a surgery and, oh my gosh, I'm in physical therapy the next day. My grandma actually just had a total knee replacement, and she is a funny, hard-headed woman. I love her to death, but she did what she was told. She went to PT like she was told, and when she was done, she was ready to be done. But she, was a little bit nervous, and I had the conversation with her, weeks before her surgery about what to expect, how it's going to feel. And I mean, she had a lot of pain. Knee surgery is painful. But we're not going to kill you the first couple weeks. And I think that's what people are scared of, that they're going to come in and I'm going to, just bend the crap out of their knee and hurt them. And that's just not the case. And that if I did that, that would not do anything but make you not want to come back and potentially hurt you.
Right.
So first couple weeks is just kind of pain reduction, getting the swelling down, getting it moving as best we can. After that initial phase, after you, like if you have staples or stitches or whatever, after you get those taken care of, your bandage comes off, then it's time to push a little bit. Range of motion is what we focus on first. With total knee surgeries, that's the main thing that we focus on to get back first, because it's the hardest thing to get back. Your knee flexion, we shoot from anywhere to 120 to 130 degrees of flexion. And your extension, we want it 0 to be able to flatten all the way. Sometimes we get that 100%, sometimes we don't, but that's what we shoot for, because that's functional. Research has shown that, that range of motion is going to let you step into your car or step onto a step, and do all the functional things that you need to be able to do. But again, we're not going to get that in the first few weeks. So that's something that we gradually progress as we go. Typically, hopefully people are around that at the 4-week mark is what we want. 4 to 6 weeks, full range of motion. But we also work on strength. And I have people day one out of PT come and get on the bike. You're not going to be able to do a full revolution on the bike, but you can move a little bit, go back and forth, get it bending, get it moving. And I think like once people start doing these things and they realize, oh, it's not that bad, then they feel like they can push themselves a little bit more too. We also do, like I do a lot of manual therapy with my total knees, do a lot of soft tissue massage on the quad. A lot of times your quad muscle kind of shuts off after a total knee replacement, because they have to cut through that muscle.
Right.
So we do a lot of things to kind of stimulate that muscle, get it to wake up. Once it wakes up, then we strengthen it as best we can. We also do blood flow restriction training. Have we talked about that yet, Dee Dee? BFR?
No.
So BFR it's kind of like a blood pressure cuff that we put on like your arm or your leg, whatever extremity that we're working on. And what it does is cuts off a safe percentage of your blood flow to your leg. And that makes your muscles work out in an anaerobic state, so without oxygenation. And that increases strength and muscle mass quicker. So it's basically like tricking your brain into thinking I'm doing 1,000 reps of this when you're only doing 10 reps, or that you're doing 50 pounds and you're only doing 5 pounds. So it makes your muscles work harder, but you don't have that external load that's going to hurt your joint, if that makes sense.
Oh, that's cool.
Yeah,
So
so that's something that we do.
The other modalities that you do with back, like dry needling, cupping, are those allowed to be done on knee replacements as well?
So typically, kind of like with your surgery, Dee Dee, we wait a little bit after surgery for the dry needling, just because there's a risk of infection early on. Usually I'll double check with the surgeon, but I'll wait 6-ish weeks and then I'll start it if I need to. Typically, if I'm doing dry needling for a total knee, I'll do it on the quad or on the hamstring just because they get tight and tense, and that helps loosen it up. We also do electrical stimulation or neuromuscular reeducation with the E-stim. So you know what a TENS unit is, Dee Dee?
Yep.
So basically you stick those sticky pads on your quad, and I have the electricity going off while you're doing an exercise with that muscle. And that kind of helps wake that quad muscle up a little bit, because like I said, it kind of shuts down after surgery, but it helps stimulate the nerves and the muscle to start working again, kind of kick starts it a little bit.
Mm-hmm.
But we do those two things a lot. We do the cupping, same thing, quad or hamstring, sometimes even the calf, if that calf gets tight after that surgery. We have something called the Normatec, which is like compression therapy, which helps with swelling, that we do a lot early on. Ice, all the normal stuff.
Now, I know you have another machine in there that a friend of mine's love. She says she feels like she's gliding, and that's the
Hmm.
treadmill. What can you explain
Hmm.
what that is and how important that is after
Yeah,
surgery? And you've gotten down the road a little bit.
yeah. So it's called the Alter G treadmill. It's an anti-gravity treadmill. And basically you get in this thing and it fills up with air and it can take away a certain percentage of your body weight. So after a hip or a knee replacement, you're technically, it's called weight bearing as tolerated. So you can put as much pressure on that joint as you feel comfortable, but you're usually with a walker for the first week, 2 weeks, whatever. We can get you in that Alter G. I mean, I get people in there quickly. First 2 weeks
Okay.
after a joint replacement surgery, get you in there, put you at 60% of your body weight, and you can walk and work on your gait mechanics normally without using a walker or leaning on a walker. And you can put, as much body weight on that joint as you want because it's not going to hurt because, 60% of your body weight's gone or whatever.
Mhm.
So you can really work on a lot of times after surgery, you have a limp on that leg and your stride length isn't equal. And
Mhm.
if you walk like that for a long period of time, that's going to hurt other joints, going to hurt your back.
Right.
You're going to get in a bad habit of walking like that. So if we get you in that Alter G treadmill and you can walk normally, you can walk without pain, and you can work on your gait mechanics, that's going to help so much
Mhm.
moving forward.
Wow. This is such great information because, a lot of people are afraid of physical therapy
Yeah.
from bad experience. And I think this is why we talked about it the last podcast, choosing your physical therapy, how to choose the right one that works for you. And definitely what I've learned is those who listen and really listen to your body and even watch. I think what makes you so great is you not only just watch what we're saying, I think you watch our body language and the things we're not saying. Because
Yeah.
sometimes we'll want to push ourselves to a point where really we can't, but I just want to see. And then we can cause
Yeah.
injury to our own selves. So I love how you do pay attention to the full thing. You're just not like, okay, go over there and do your thing. You know what I mean?
Right.
Like you really watch and pay attention.
Yeah.
So it's very important that in owning your own recovery is that you do take the time to find a good therapist for you. We definitely refer everybody over to you. I highly
Yeah.
speak of you guys so much because I know how much you care. It is not just a patient for you. It is actual individual inner being, and you guys actually treat us like family. If that
Yeah.
makes sense, like I really feel like
Yeah.
I'm coming there with family, and we laugh and we talk. But definitely, I have appreciate you teaching so much and really taking the sting out of physical
Yeah.
therapy and the fear
Yeah.
of thinking it's going to be this massive thing, and really it's walking you through your own healing process so you can do the
Yeah.
same thing at home. That's so
Yep.
great. So what would you like to leave with women as they go on this journey for those? Oh, I know what question I had. What's the youngest knee replacement and hip replacement have you seen?
Ooh, I would say she, gosh, was probably in her 30s, this hip replacement.
Wow.
But she had uh, like a deformity she was born with,
Hmm.
that, wasn't really going to be able to get fixed by other things. She had other surgeries in the past that just didn't really work. So she ended up having to have a total hip. She recovered great. And actually, when I was doing my research this week, Dee Dee, the hip replacements are happening younger and younger because they just heal so well and the outcomes are so good. And I think that's another reason why surgeons aren't requiring their patients to do therapy because, the younger patients are, if they're doing a hip replacement on them, they're probably very active. They're probably going to do all their exercises and all that stuff. But
Right.
I think that's excluding, the middle aged to older population that are getting hip replacements too.
Right.
that may not be as active or may not be as well versed in what exercises they should and should not be doing at that time.
Mhm.
Um, so anyway, around 30, mid 30s probably was this girl that I saw that had a total hip, and she was
Wow.
just a special case.
Mhm.
Total knee. Who I think I had a guy in his late 40s have a total knee, and I am pretty sure his was he had like a car accident, so it had a traumatic injury to it, and there was just nothing else to be done. But again, that's not the norm. My normal total hips, total knees are, you know, 60s to 70s,
Mhm.
roundabout. Sometimes a little bit younger, sometimes a little bit older. But that's my typical is that age range for my joint replacements, especially hips and knees.
Okay.
So yeah,
So there's a lot that we can do now in our 40s and 50s to kind of help mitigate not having to have that later
yeah,
on in life.
yeah,
So definitely that's some great information that we can take. Any other tips you can give us that you want to share that maybe I hadn't thought to ask?
yeah.
Uh,
I think, like you talked about, there are some things that you can do to prevent and or prolong having to have these kind of surgeries. Activity is the number one thing. Um, but also, and I try to stress this to my patients, is not just activity, but a variety of activity and exercises, like I mentioned earlier. If you're just only walking every day, that's great, but do some strength training with it, or do some yoga, or do something else along with that, or some swimming. I don't care what it is, but mix up your exercise routine a little bit, because that's what helps strengthens your joints is a variety of different things that you do, that puts different types of load on your joints. That's what's going to help prolong your joints the best.
oh, wow.
Um,
Okay.
so I think that is the number one thing that I would tell people is yes, be active as you can, but also have a variety in your activity and exercise. And also, like early on, if you have some hip or knee pain, go see a PT about it. Don't push that off until it's so bad that you can't stand it anymore, because at that point, it's going to be injections or some sort of surgery or a total joint replacement. Come see me before it gets to that point, and we can, try to figure out if we can
Yeah.
prolong it or prevent it. The only other thing that I had written down is like insurance limitations. I think some people don't want to come to PT initially because they have like a high copay or a deductible that they have to meet with PT. And if your surgeon doesn't require it, well, then why would you spend the money to do that?
Right.
Um, and that's always something. If people come to me and they, have to pay a lot of money a visit, I can give you a really good home exercise program. You can come in once a week, once every 2 weeks. We can make it work. That's going to work for you.
Right.
Um, but it's still worth coming in and like talking to me about it. Because we can figure out a game plan that's going to work for you and that's going to be beneficial for you.
Right.
Um, but that was one of the main reasons that people after a hip replacement surgery decide not to come to PT, because their surgeon doesn't require it and insurance issues. So
Yeah. Yeah. I think it's important that for you to push past that. If you're listening to me, because you rather pay the money up front and get the information versus 6 months down the road, and now they have to come to you regardless of what the money is. And I like how you're willing to give information to help and to work with. So that's great to know that it's just not okay, if you don't come, then you just don't go. They'll get the
right,
information, but you're willing to help educate them. And then I
right,
think what I feel like is important to me is maintenance. I feel like because there's sometimes you can get comfortable and you forget a few things. I think maintenance is good to just come in too every once in a while and just say, hey, I'm kind of struggling with this or I'm kind of
yeah,
struggling with that, just to get the information. Because you guys are definitely a wealth of information and you truly, I
yeah,
can't stress this enough, you truly, truly care. And that is what's so important, because I've heard the stories of people stating that they don't listen to me, they don't pay attention to me. And I think your recovery will go a lot better when you're teamed up with the right person. So, can
Yeah.
you give all of the locations where they can find you all? Because, of course, Arkansas has gotten pretty big.
Yeah, absolutely.
So, where can they find you guys at, and in the other locations?
Yep. So Physical Therapy Institute is the name of our company. I'm at the Sherwood location. We have one in Maumelle, Benton, and West Little Rock, and then one in the Heights. The best way to get a hold of us is to just call us. Um, uh, I mean, all the clinics are in that number, and then you have different options as well to get the specific clinic.
Mhm. Can you give them
I
the number?
Yes, and I am also going to give you my email um, as well. Um, my email is jandrews@ptipt.com. So if you have any questions, just shoot me an email. The phone number is 501-301-4530 for the generic PTI
Mhm.
number. And I thought I had each of the options for which clinic is which, but I don't have that written down.
Okay.
I know Sherwood's option 2,
Mhm.
and then it will say on the
Yeah.
voice memo or whatever which clinic is which option. So whichever one you live closest to, you can click that number and just chat with them.
Mhm.
Um, and I would say, even if you don't have a referral from your physical or from your doctor, and you're wondering if you can come to PT without it, just call us, and we can look up that information for you and see if you do need a referral or if you don't, and kind of guide you in that way.
Oh, that's awesome.
Yep.
Well, I have enjoyed you
Well,
always.
thank you.
We got to do this again.
Would love to.
I was telling you that I really want to do the behind the scenes and take the podcast into the actual facility and kind of show
Yeah.
some of the things we've been talking about, so you'll know what they are, and then also kind of show you in action, and me be your guinea pig.
Yeah. I would love that. Sounds great.
Awesome. Well, this has been an amazing, amazing another podcast. Again, please like and share. If you have not subscribed, please subscribe. Go on over to PTI and meet with them. I promise you, you will not regret it. And as I say in all podcasts and in this way, listen, I love you. God loves you, and there is nothing you can do about it. Bye for now.